Good morning. Time for our Fox 4 house call with Dr. Andy. And this morning talking about something very serious, colon cancer. It kills thousands and thousands of Americans every year and oftentimes goes undetected.
Right. In 2007, it killed over 50,000 new Americans and probably affected over 154,000 people in the United States.
And there's a test that we know through like Katie Couric and all the programs out there, the colonoscopy.
Absolutely.
But it's a real pain, to say the least.
Well, to be fair, if it's done appropriately, if it's done correctly, it shouldn't really be a pain. It's it's a test that everybody dislikes getting, and it's a test I have a hard time, and a lot of doctors have a hard time convincing our patients over 50 to go and get, because it involves a very, very long camera that's inserted in the rectum to look inside the colon.
Just doesn't sound fun.
It doesn't sound fun. You're absolutely right. The good news is that when you get it done, everybody in our area uses anesthesia, which really knocks you out. You don't remember anything.
Oh, that's good.
The worst part is taking the stuff beforehand that cleans you out. But there's something on the horizon called virtual colonoscopy.
And how's this going to work?
Well, it's also called CT colonography. And what that means is they use a CT scan to take a picture, and they basically take a picture of your colon. It involves CT scanners that are a little bit more sophisticated than what you might find in the average radiology center.
Okay.
Radiology Regional here in Fort Myers does have one. And it requires very sophisticated software and radiologists that are experienced in reading them. And I've had a lot of patients asking me in the past, I don't want to get a colonoscopy, I want to wait for a virtual colonoscopy.
Right.
And there was a study that came out last week, and there was an article in the paper that generated a lot of phone calls. I thought that's why it would be a good topic for this morning.
And how accurate are these results?
Well, and that's the big question, how accurate this is. And this is the first study in the current New England Journal of Medicine that really looks at how accurate they are. And they found that it missed about 10% of the polyps or growths in the colon that are about 1 centimeter or more in size.
And that's serious.
Well, it is serious. The average colonoscopy, there have been some guesses they miss anywhere from 3% to 6%. So 10% is a big miss. For smaller lesions, they miss up to 22%. So it's a good test. It's really interesting, and it's only going to get better. But unfortunately, the bad news is virtual colonoscopy is not yet here for most people.
Not a substitute for the real thing.
If you're 50 and you haven't had a colonoscopy yet, talk to your doctor, and it's not as bad. One more point worth making with the virtual colonoscopy, you still need the same prep. You have the same stuff to clean you out. You just get to skip the camera part, which you wouldn't remember anyways.
Since you got the anesthesia. If you have any questions, you can feel free to email Dr. Andy about this topic or any other one. Who knows, it might become a feature on our medical segment, 694-6246. Dr. Andy, thanks so much.
Always a pleasure.